You know that feeling when you encounter a really big piece of proposed legislation? The kind that spans hundreds of pages and seems to touch on, well, just about everything. It can feel a bit overwhelming, like trying to navigate a dense system without a map.
Oh, absolutely. Yeah. Major bills often bundle together incredibly diverse policies, making it pretty tough sometimes to see the specific changes being proposed underneath all that complexity.
That's exactly why we do these deep dives. We take your sources, the articles, research notes, briefing docs you send, and we try to slice through the legislative language, find the crucial details, the specific
The
mechanisms.
things that actually show you what's going on.
Exactly. Think of it as our way of exploring the bills on the Hill, really sifting through the noise to find the signal.
And today, we're applying that approach to H.R.1. Specifically, we're focusing our deep dive on Title IV. And the sources we've got detail a truly broad range of policy areas within just this single title.
Yeah, it's pretty amazing, stretching from significant changes in energy and environmental funding, regulation, all the way through some pretty substantial alterations in major healthcare programs.
Right, like Medicaid, Medicare Part D, and even the ACA exchanges.
So our mission today is clear. Walk through this source material together, pull out the most important facts and ideas as they're presented in these documents, and give you an impartial look at what this section of HR1 is proposing.
No outside analysis, just a focused look at the text and the descriptions that you've provided.
Okay, so where do the sources start us off for Title IV?
Let's begin where they do, which is the first part addressing energy and environment. That's under subtitles A and B. And a core action highlighted right away is a significant rescission of unobligated funding.
Okay, unobligated funding and rescission. Those definitely sound like budget terms. For clarity, how do the sources explain what those mean here?
Yeah, good place to start. The sources explain that unobligated funding refers to money that Congress previously appropriated,
Yeah.
to authorize it, set it aside for a specific purpose, maybe through something like the Inflation Reduction Act of 2022, Public Law 117-169.
Right.
But that money hasn't actually been committed yet. It hasn't gone out the door for specific projects or contracts. It's allocated, but not spent or tied up.
Got it. So it's sitting there earmarked but not spent.
Exactly.
Yeah.
And a rescission then is basically the cancellation of that budget authority. It's the bill saying we're taking back that money that was made available but hasn't been used yet.
So this section is essentially canceling the permission to spend specific money from the Inflation Reduction Act, money that hasn't been assigned to a project. What kinds of programs are we talking about, according to the sources?
Well, the documents indicate this impacts a really wide array of programs: clean energy, emissions reduction, environmental programs that got funding through the IRA. Subtitles A and B apparently detail the specific programs targeted. But what's notable, and the sources explicitly point this out, is that while they are clear about which funds are being rescinded, the documents don't analyze the potential broader impacts. The consequences of these rollbacks on, say, clean energy development or environmental goals.
That's an important boundary based on our source material, then. They state the action but not the ripple effects.
Precisely. Our analysis is strictly limited to what these sources actually contain.
Okay. Moving on from funding, then, the sources also describe proposed changes to pipeline permitting. Section 41006, it creates a new section, Section 7A, within the existing Natural Gas Act. But it's not actually for natural gas pipelines, is it?
Exactly right. The documents specify this new Section 7A applies to interstate pipelines that are transporting carbon dioxide, hydrogen, and petroleum or petroleum products.
Oh, okay.
The sources note that natural gas pipelines are already covered elsewhere in the Act.
So a new federal process specifically for these other substances, how would it work based on what the sources say?
Well, the process laid out involves applying to the Commission, and the sources strongly imply this means FERC, the Federal Energy Regulatory Commission, for a license.
Okay.
There's an application fee required, too, under Section 41006B. Now, that specific section doesn't state the amount, but the sources do mention that other sections in Title IV, the ones related to fees for natural gas imports and exports, mention a potential charge of $1 million.
$1 million, but is that linked to this pipeline fee?
Well, that's the thing. The sources are careful to point out this $1 million figure isn't directly linked in the documents to the Section 41006 fee. For Section 41006, it just says a fee is required.
Okay. So apply to the commission, pay some kind of fee. Then what happens?
Then the sources state the Commission would review these applications using procedures similar to those already in place for Natural Gas Act, Section 7 applications, the ones for certificates of public convenience and necessity. It specifically references Section 70.
Okay, using existing procedures.
Right, though they can modify them as needed for this new Section 7A. But here's where it gets particularly significant based on the sources. The procedures of Section 7H of the Natural Gas Act would apply.
And Section 7H, wait, that deals with eminent domain, doesn't it?
Precisely. The sources indicate this means that licensees under this new Section 7A, if they get their license approved, would have the right of eminent domain.
Wow.
Yeah. It allows them to acquire the necessary property for the pipeline project, even if they can't get it voluntarily through a contract. It's basically leveraging a powerful tool from the existing natural gas framework for these new types of pipelines.
Okay, so on one hand, creating a defined federal process, leveraging existing procedures, maybe streamlining land acquisition with eminent domain, that could be seen as facilitating development.
Potentially, yes.
But the sources also seem to raise questions, maybe by what they don't detail about this new process.
That's a good way to put it. The sources point out that the bill's description, as they present it, doesn't explicitly detail how an environmental review specifically tailored for CO2 or hydrogen or petroleum pipelines would actually be conducted. It just references the existing NGA procedures.
Right.
And the sources don't analyze whether applying that existing framework is really optimized for the unique characteristics or maybe safety considerations of these different substances compared to natural gas.
And what about the landowners with the eminent domain piece?
Well, that's another point. The eminent domain provision, while it uses existing law, isn't accompanied by any new details in these sources about specific landowner protections under this expanded application.
So it seems like it maps an existing process onto new substances, but leaves some of the specific adaptations or implications less detailed in the documents we have.
That seems fair based on the source descriptions.
Okay. Still in the energy section, the sources also mention something called a de-risking compensation program, Section 41-07.
Yes, Section 41-07. The sources describe this program as being aimed at coal, critical minerals, oil, natural gas, and nuclear energy projects.
De-risking compensation. What's the basic idea there?
The program, as described, is designed to provide compensation to the sponsors of these specific types of energy projects if they're negatively affected by certain subsequent federal government actions.
Like what kind of actions?
The sources specify things like regulatory decisions or actions that revoke a permit, maybe cancel a project entirely, cause significant delays, or otherwise just render the project unviable.
And how would a project sponsor get this compensation if that happened?
According to the sources, first they have to apply to enroll their project in the program. If it's accepted, they pay a one-time enrollment fee. That's set at 5% of their capital contribution for the project.
Okay, a 5% fee up front.
Right. And then they also pay annual premiums. The Secretary sets these, and initially they start at 1.5% of the capital contribution, but the sources say they can range up to 5% annually.
And where does the money for the compensation actually come from?
It comes from a dedicated fund, logically named the De-risking Compensation Fund. Those enrollment fees and annual premiums go into this fund.
Are there limits on how much a project can get?
Yes, there are limits mentioned. The compensation can't exceed the sponsor's total capital contribution to the project, and it's further capped at no more than 50% of that amount.
Half of their investment max.
Right. And the sources also note the Secretary has to make sure that the payments going out don't exceed the funds available in the fund itself. It has to be self-sustaining, apparently.
Okay, so let's recap the energy and environment part of Title IV based on these sources. We've got rescissions of IRA funds, a new permitting process for specific non-natural gas pipelines using eminent domain, and this compensation program for certain other energy projects against adverse federal actions.
That covers the main points from subtitles A and B. Now let's transition because Title IV then takes a big turn into healthcare. Subtitle D presents a really substantial package of policy changes across Medicaid, Medicare Part D, and the ACA exchanges.
Right, and this is where the sources seem to provide a lot of really specific detail on how programs would actually work or change. A prominent area covered seems to be restrictions related to gender transition procedures.
It is, yes. The bill, as described in the sources we have, provides very specific definitions here. For instance, specified gender transition procedure is defined as any medical intervention, surgical or pharmaceutical, that's performed with the intentional purpose of changing an individual's body, so it no longer corresponds to their sex, as that term is biologically defined in the bill.
And the list of procedures included in that definition is quite detailed in the sources, right?
Extremely detailed, yes. The sources list various surgeries, things like castration, sterilization, hysterectomy, phalloplasty, mastectomy. It also includes plastic, cosmetic, or aesthetic surgeries meant to feminize or masculinize features, like placing chest or gluteal implants.
And it's not just surgery. Certain medications are included, too.
Correct. The definition, according to the sources, also covers the administration, prescribing, or dispensing of specific medications. They mention GnRH analogs or other puberty-blocking drugs used to stop or delay normal puberty,
Okay.
and also testosterone, estrogen, or other androgens if they're given at doses higher than what would normally be produced endogenously in a healthy person of the same age and sex.
So that's the procedure definition. And you mentioned the bill also defines sex biologically. How do the sources describe that definition?
They do. According to the sources, the bill defines sex as either male or female, based on the individual's biological sex characteristics, specifically the natural reproductive system's typical ability to produce and utilize eggs or sperm.
Mm.
The definition also apparently accounts for developmental anomalies or accidents affecting those systems.
Okay. So with those specific definitions in place, what's the main prohibition that the sources detail regarding federal funding?
The sources are quite explicit here. The bill prohibits the use of federal Medicaid and CHP funds for any of those specified gender transition procedures for individuals who are under 18 years of age.
Under 18 for Medicaid and CHIP. And what about the ACA exchanges?
Additionally, it prohibits these procedures from being covered as an essential health benefit, or EHB, under plans offered on the ACA exchanges.
Are there any exceptions listed in the sources? Situations where these procedures could potentially be covered?
Yes, the sources do outline several specific medically necessary exceptions. These include procedures to treat precocious puberty,
Okay.
or for treating medically verifiable disorders of sex development. And the sources actually provide examples there, like 46XX with virilization, or 46XY with undervirilization, things like that.
I see.
Exceptions also cover procedures needed to correct problems resulting from a previously performed prohibited procedure, or for cases where there's imminent physical danger to the individual, though the sources explicitly state this danger excludes the alleviation of mental distress.
Excludes mental distress. Any other exceptions?
Yes, finally, procedures to restore or reconstruct the body after previous gender transition procedures are also accepted. The sources give examples like removing a pseudophallus or breast augmentation reversal, essentially.
Now, it seems really important here to note how the sources themselves characterize these specific provisions. This isn't our analysis, but what the documents say.
Absolutely. The sources we were provided characterize these provisions as creating inequality in access to health care, specifically for transgender individuals. They suggest this disproportionately affects what they term a vulnerable population and could potentially harm health outcomes by limiting access to care, which these sources describe as medically necessary.
Right, so that's the framing and the potential impact analysis presented within the source material we're working from, just reporting what's there.
Exactly.
Okay, moving beyond that specific prohibition, the sources detail several other significant changes to Medicaid. What's next?
Well, one is a change to budget neutrality for demonstration projects. This is in Section 44121. Basically, starting from the bill's enactment date, the Secretary of HHS could only approve, renew, or amend Medicaid demonstration projects, waiver projects, if they are certified as being budget neutral to the federal government over the life of the project.
Okay, so ensuring these special projects don't end up costing the federal government more money. Another area seems to be retroactive coverage. The sources indicate a pretty significant change here.
They do, yeah. Section 44122 alters the period of retroactive coverage for both Medicaid and CHIP. Currently, if someone's eligible, they can have services covered for up to the third month before the month they applied.
Right, which helps cover bills if someone gets sick suddenly and then applies.
Exactly. The bill, as described in the sources, reduces this period significantly. It would only cover services in or after the month before the application month, so much shorter window.
And the sources connect that to a broader theme they see in Title IV.
Yes. The sources discuss this change within the context of what they characterize as Title IV's broader philosophical approach, emphasizing personal responsibility for certain beneficiaries. While they don't explicitly detail the impact on individuals maybe facing a sudden health crisis right before applying, The sources frame this reduction in the safety net aspect of retroactive coverage as fitting within that larger theme of the legislative package.
And when would this change take effect?
This change is said to apply to applications made on or after October 1, 2026.
Okay, that's a substantial change in that time frame. Another major policy shift detailed in the sources is the introduction of community engagement requirements. That's section 44115.
That's right. This provision, which is scheduled to take effect on January 1st, 2028, would require certain Medicaid enrollees, the bill refers to them as applicable individuals, to participate in specified activities for at least 80 hours per month.
80 hours a month. What counts as a specified activity according to the sources?
The sources list several things: work, community service, participation in a work program, enrollment at least half-time in an educational program, or some combination of those. Alternatively, meeting a certain income threshold based on minimum wage also fulfills the requirement.
And what happens if someone who is required to do this doesn't meet that 80-hour requirement?
According to the sources, the consequences are pretty stark. They would lose their Medicaid eligibility.
Lose coverage.
Yes. And furthermore, the sources state that individuals who lose eligibility solely because they failed this requirement are also deemed ineligible for the ACA exchange premium tax credits and cost-sharing reductions.
Wow, so it affects both Medicaid and ACA subsidies potentially.
It seems so, yes. The sources present it as making this requirement a condition for maintaining both Medicaid coverage and access to financial help on the ACA marketplace for those individuals subject to it.
Are there exceptions? Are some people exempt from this requirement?
Yes, the bill does list specified excluded individuals who are exempt. The list in the sources includes people under 19, pregnant individuals, those eligible for Medicare, certain individuals with disabilities, caregivers of dependents, veterans with a total disability rating, people who are medically frail, and others the Secretary might specify. States would be responsible for determining who qualifies under these exceptions.
Okay. The sources also highlight changes to how citizenship and immigration status are handled for Medicaid and CHIP eligibility. What's changing there?
This is Section 44110. It prohibits federal Medicaid and CHIP funds from being used for individuals who haven't verified their citizenship, nationality, or satisfactory immigration status after they've been given a reasonable opportunity to provide documentation.
Okay, that sounds somewhat like current rules, but is there a key difference?
Yes, a key point the sources emphasize is that this section eliminates the state requirement to provide medical assistance during that verification period while the person is trying to get their documents in order.
Ah, I see. So states wouldn't have to cover care during that waiting period anymore.
That's how the sources describe the change. They also note restrictions on comprehensive health benefits and financial assistance for health insurance coverage for non-qualified aliens, or those not otherwise lawfully residing in the U.S.
That seems like a significant shift in state practice during verification. What about pharmacy payments within Medicaid, Section 44123?
Right. Section 44123 addresses ensuring accurate payments to pharmacies. The bill includes amendments that reference methodologies like NADAC, the National Average Drug Acquisition Cost, and WAC, Wholesale Acquisition Cost. It also contains provisions for collecting data from pharmacies, including data on their affiliates.
Affiliates meaning pharmacies owned by the same parent company, maybe.
Presumably, yes. And the sources note the bill actually mandates the Inspector General to conduct a study specifically looking at how these pharmacy affiliates might influence costs compared to non-affiliated pharmacies.
Interesting. The sources also cover a prohibition on federal funding for entities that perform abortions.
Yes, Section 44126. It states the bill prohibits federal funds, and that includes Medicaid funds, from going to certain entities that are primarily engaged in family planning or reproductive health services if they perform abortions.
Are there exceptions?
Yes. The sources note exceptions for cases of rape, incest, or where the abortion is necessary to save the life of the mother. This prohibition, as described, is set for a period of 10 years.
10 years, okay. And finally, on Medicaid, the sources briefly mention limitations on state-directed payments and rules for healthcare-related taxes.
Just quickly, yes. Section 44127 requires the Secretary to revise regulations to limit the total payment rate for state-directed payments under Medicaid managed care. The limit is set at 100% of the specified total published Medicare payment rate, although existing approved payments are grandfathered in.
Okay.
And Section 44128 briefly touches on limits for state healthcare-related taxes that are considered generally redistributive, using some specific tests based on the proportion of Medicaid versus non-Medicaid taxable units.
Wow, okay. That is a lot of changes detailed for Medicaid in the sources. Now, shifting focus to Medicare Part D, the prescription drug benefit, the sources detail significant provisions aimed at pharmacy benefit manager or PBM accountability.
Yes, this is Section 443 Euro 5, titled Modernizing and Ensuring PBM Accountability in Medicare Part D. The provisions here are set to take effect for plan years beginning on or after January 1st, 2028.
And what's the sort of central restriction being placed on PBMs here, according to the sources?
A core restriction, as the sources describe it, is that PBMs would be prohibited from deriving remuneration, basically, their earnings, beyond what are defined as bona fide service fees for covered Part D drugs.
Okay, bona fide service fees. How is that defined in this context, based on the sources? What makes a fee bona fide?
The sources describe it as a fee that meets several criteria. It has to be a flat dollar amount. It has to reflect fair market value for a genuine, itemized service the PBM actually provides to the plan sponsor. And importantly, it cannot be based on factors like the drug's price or discounts or rebates received or where the drug is placed on the formulary.
Ah, okay. Not tied to the drug price or volume.
Right, with the exception of certain specific allowed performance incentives. And the documents emphasize that manufacturer rebates, discounts, price concessions, those are not considered a violation if the PBM fully passes them through to the plan sponsor.
So the PBM can't keep those rebates as profit, essentially.
Exactly. Any revenue the PBM gets that doesn't meet this bona fide definition must be disgorged, meaning returned to the plan sponsor. The aim, as suggested by the sources, seems to be making PBM compensation much more transparent and clearly tied to services rendered, rather than drug costs or rebate negotiations.
And this section seems heavily focused on transparency, particularly through some very detailed reporting requirements.
Absolutely. The sources highlight mandatory, detailed annual reporting required from PBMs. This report has to go to both the plan sponsors and the Secretary of HHS every year, starting by July 1st, 2028. And here's the really crucial part. The reporting must be broken down by drug.
By drug. Not just overall, but for each individual drug. That sounds incredibly granular.
It does. Extremely granular.
What kind of data points are PBMs required to report for each drug, according to the sources?
Well, the sources list a pretty lengthy set of data points. For each drug, they'd need to report its brand or generic name, its national drug code, NDC, the wholesale acquisition cost, WAC, that's the manufacturer's list price, the average wholesale price, AWP, the total amount enrollees paid out of pocket for that drug,
Okay.
the total manufacturer rebates and all other direct and indirect remuneration, DIR fees collected for that drug, the average amount the pharmacy was reimbursed, broken down by dispensing channel like retail versus mail order, the average national average drug acquisition cost, any DAC for the drug,
Still going.
and the total manufacturer-derived revenue that was retained by the PBM and any of its affiliated entities, specifically attributable to that single drug.
Wow. That level of detail, as the sources suggest, seems designed to provide, well, unprecedented transparency into how money flows for every single drug within the Part D system.
That certainly seems to be the intention described.
There are also specific reporting requirements mentioned related to generics and biosimilars and also PBM-affiliated pharmacies.
Yes. On generic and biosimilars, the report must list any lower-cost generic or biosimilar product that is not covered or is covered less favorably on the formulary when a higher-cost brand or reference biologic is covered.
So if they prefer the expensive one.
Right. And the PBM has to provide the estimated beneficiary cost sharing for both the expensive and the cheaper option and give a written justification for why they're favoring the higher-cost product. The sources suggest this directly targets potential barriers PBMs might create for getting patients onto lower-cost alternatives.
And the affiliated pharmacies piece.
If a PBM owns or controls a pharmacy, an affiliated pharmacy, the report has to compare how those affiliated pharmacies perform versus non-affiliated network pharmacies. This includes things like the percentage of prescriptions dispensed by affiliates, the range of costs, the lowest cost available anywhere in the network, and any benefit designs that might encourage or steer enrollees toward using the PBM's own pharmacy.
Addressing concerns about steering patients, any other transparency measures mentioned?
The sources note PBMs also have to provide written explanations to plan sponsors about any contracts they have with manufacturers, where financial incentives for one drug are somehow contingent on conditions tied to another drug, trying to untangle those complex deals.
Okay.
And importantly, plan sponsors are explicitly granted audit rights. They can audit the PBM at least annually to verify compliance and check the accuracy of all this reported data.
So mechanisms for verification. And beyond these direct PBM regulations, the sources also mention some mandated studies related to the drug supply chain.
Correct. The Government Accountability Office, the GAO, is required to study and describe the compensation and payment structures across the entire Part D supply chain. They're tasked with looking at potential conflicts of interest and the effects on the program, on beneficiaries, including how generics and biosimilars are adopted. That report is due within 2 years.
And MedPAC, too.
Yes, MedPAC, the Medicare Payment Advisory Commission, is also required to submit reports analyzing PBM agreements and their effects on enrollee costs and pharmacy reimbursement. These studies, as detailed in the sources, seem aimed at providing independent analysis of those really intricate financial flows within the Part D drug supply chain.
Okay. Just a couple of other, maybe smaller healthcare provisions mentioned in the sources before we move on.
Just briefly, yes.
Hmm?
Section 44303 apparently delays certain scheduled reductions in disproportionate share hospital, or DSH, payments. And Section 44302 aims to streamline the enrollment process for eligible out-of-state providers under Medicaid and CHP, though that particular provision takes effect 4 years after enactment.
Got it. Okay, now let's turn to the ACA exchanges, the Affordable Care Act marketplaces. Subtitle D, Part 2, also contains several provisions here.
It does.
One we've already touched on, actually, is the prohibition of those specified gender transition procedures as essential health benefits. That was Section 44201.
Right, that applies here too. The sources also note a prohibition on special enrollment periods, or SEPs, that are based solely on an individual's income changing relative to the federal poverty line. That's set to begin with planned years starting on or after January 1st, 2026.
Okay, limiting reasons for signing up mid-year. There are also new requirements detailed in the sources for individuals who receive the advanced premium tax credits, the APTCs, that help lower premiums.
Yes, starting in 2025 or maybe 2026, depending on specifics, individuals will be required to have filed their prior year tax returns and also reconciled any advance payments they received in past years.
So ensuring people are squared away with the IRS before getting more credits.
Seems to be the goal. The sources also indicate the removal of automatic extensions for resolving income inconsistencies reported by the exchange. This puts more of the onus back on the individual to prove their income and eligibility promptly.
Okay. Other changes mentioned include revising rules on allowable variation in actuarial value.
Yes, and also an adjustment to the APTC amounts themselves. Section 44201 introduces a reduction of the APTC amount by $5 per month for individuals termed specified re-enrolled individuals. This starts in 2026 or 2027, depending on the type of exchange.
A $5 reduction for certain people, and one last ACA point from the sources.
Yes, starting in 2026, the sources note a provision that would allow insurers to attribute an initial premium payment for new coverage to any prior unpaid premium amounts the person might owe to that same insurer or another insurer within the same controlled group.
Ah, so they could use your first payment to cover old debt before applying it to the new plan.
That appears to be the mechanism described.
Okay, so Title IV is just packed. Substantial changes to Medicaid eligibility, funding, administration, new regulations, and major transparency requirements for Medicare Part D PBMs, and several modifications to the rules for ACA exchange enrollment and premium assistance.
That really covers the major energy, environment, and healthcare sections detailed in the sources we have. But Title IV, as presented in these documents, actually dips into other areas too, including artificial intelligence and information technology modernization.
Right, let's touch on that briefly. Subtitle F includes Section 43201, describing an AI and IT modernization initiative. What do the sources say about that?
The sources state this section appropriates $500 million to the Department of Commerce. It's for fiscal year 2025, and the funds are available through September 30, 2035.
$500 million. And what's that funding specifically intended for, according to the sources?
It's designated for modernizing and securing federal IT systems, specifically within the Department of Commerce. The description mentions deploying commercial AI and automation tech, replacing old legacy business systems.
Okay.
Facilitating the adoption of AI models to boost operational efficiency and service delivery, and also enhancing cybersecurity through updated architecture, automated threat detection, and integrating AI solutions. That's all based on the description in the sources.
And this section also contains a pretty significant provision regarding the regulation of AI outside the federal government, right?
Yes, quite significant. It imposes a moratorium, basically, a halt on state and local laws or regulations that specifically regulate AI models, AI systems, or automated decision systems.
A halt on state and local AI-specific rules For how long?
The sources state this moratorium is for a period of 10 years.
10 years, wow. A decade-long pause on state and local AI-specific regulation. Are there any exceptions listed in the sources? Can states regulate anything related to AI?
There are some important exceptions listed, yes.
Yeah.
The sources say state or local laws would not be preempted or halted if their main purpose is to remove legal hurdles or actually facilitate the deployment of AI.
Okay, so laws helping AI are okay.
Right. Or laws that streamline processes like licensing or permitting in a way that helps AI adoption. Also accepted are generally applicable laws, think consumer protection, anti-discrimination, that don't impose unique or different burdens on AI systems compared to other systems performing similar functions.
So a general law applying equally isn't blocked.
Correct. And finally, reasonable cost-based fees or bonds are also allowed if they're applied similarly to AI systems and comparable non-AI systems.
Okay, so even within this single title of what sounds like a very large bill, we see policies spanning clean energy funding rollbacks, new pipeline infrastructure rules, fundamental changes to access for specific medical procedures under major health programs, a deep dive into the financial mechanics of prescription drug pricing, and even setting the regulatory landscape for cutting-edge technology like AI.
It's really quite something. What's fascinating here, just looking across the source material you provided for this deep dive, is how these seemingly very disparate topics are packaged together within just one section of this proposed bill, H.R.1. And we've relied solely on these documents you gave us to understand the specific mechanisms and the changes being advanced.
And that really underscores the power of doing a deep dive like this, doesn't it? Looking closely at the definitions like defining sex biologically, or outlining those specific medical procedures, or digging into the intricate requirements for PBM reporting broken down by each drug.
Right, or mapping eminent domain onto new types of pipelines, or detailing the specific exceptions to a state AI moratorium.
Exactly. These specific points, pulled directly from the sources, they reveal the concrete actions being proposed far more clearly than any high-level summary ever could.
Indeed. It allows you, the listener, to really see the specific points of potential impact. The energy provisions affect policy direction, infrastructure development. The healthcare changes touch on access to care. They redefine safety nets for vulnerable populations. And they attempt to alter the whole economics and transparency around prescription drugs.
And that AI moratorium raises huge questions about the future balance of power and technology regulation across the country.
Absolutely.
So, as you consider all these details, pulled straight from the source material we reviewed today, think about how these diverse and specific changes, all bundled together within the single title, might reflect broader legislative priorities or perhaps strategic approaches being used in Congress today. It's not about agreeing or disagreeing with the policies, but about understanding what the sources actually say they are.
Which raises, I think, an important question for you to consider as we wrap up.
Mhm.
Given the sheer breadth and variety of topics packed into just this one section of H.R.1, from rescinding energy funds and setting pipeline rules to overhauling parts of Medicaid and Medicare and placing limits on AI regulation, what does that suggest about how major policy is being crafted and advanced in Congress these days?
Yeah, what does that packaging tell us? It's definitely something to mull over as you process how these detailed changes, drawn directly from the documents you shared with us, might impact various sectors and individuals. That's our deep dive into Title IV of H.R.1 for today, based entirely on the sources provided.